you've never been diagnosed with a true anxiety disorder, everyone can understand what anxiety feels like. So it's helpful to think about your anxiety symptoms, sweating, heart racing, feeling very nervous, to understand these 6 anxiety disorders, even though these symptoms are usually more intense and tied to different events, different situations or circumstances. So the first one is a phobia. Now, many people are afraid of things, but a true phobia is a very intense and irrational fear of an object. So I don't like snakes. If I see a snake, I'm not going to go near it. I'm going to avoid it. But if I had a true snake phobia, if I saw a snake in my parking lot, I wouldn't be able to go back out there for a long period of time because of this very intense fear. So phobias are intense but related to a specific thing. There are phobias of snakes and spiders and some of your common fears, but there's also other phobias like social phobia or agoraphobia. Agoraphobia is when someone is very afraid of leaving their home. So make sure you're familiar with what a phobia is and some of the examples that I've given you. The second type of anxiety disorder is panic disorder. Panic disorder is a diagnosis given to people that have enough panic attacks to where it's impacting their life in some way. Now, panic attacks can be very scary. In fact, many people feel as if they're having a heart attack while they're having a panic attack. But the truth is that many more people will have a panic attack than will ever be diagnosed with panic disorder, because many people will have one panic attack and they'll never have another for the rest of their life, or maybe they'll just have a few. So again, panic attacks are more common, but panic disorder is a diagnosis we give to people who have enough of those to where it's problematic in their lives. The third anxiety disorder is OCD, obsessive compulsive disorder. Now this one's kind of worked its way into popular culture. There have been a lot of recent TV shows about this. Some of them are pretty accurate, some not so much, but you'll want to be familiar with what obsessive compulsive disorder involves. Basically, it's when someone has repetitive anxiety thoughts and feelings that are usually tied to some pattern or some type of situation. And the only way they feel they can relieve that anxiety is to engage in ritualistic or repetitive behaviors. There's lots of different types of OCD. Some people are what we call checkers. And so they will have to check to make sure their door is locked maybe 20, 30, 50 times before they're able to feel comfortable leaving their home. The obsession is that someone's going to break in and steal all of their belongings, perhaps. And so that thought is so powerful, the only way they can relieve it is to just consistently check to make sure that door is indeed locked and they didn't make a mistake. There's also people who are cleaners. And again, some people don't like germs. Some people carry around, that antibacterial wash. But someone with true OCD might scrub their hands so much that they actually bleed. So someone with that type of OCD might have the obsession, the recurring thought, that they're going to get sick, that there's germs on their hands. And the only way they can relieve that anxiety is to engage in the behavior of ritualistic washing, or just repetitive washing. The fourth anxiety disorder we'll talk about is ASD. It stands for acute stress disorder. ASD is when you have a traumatic event occur. Maybe you're in a car accident, maybe you've lost a loved one, and for up to 4 weeks after that traumatic event, you're experiencing anxiety, you're having nightmares, you're having flashbacks even during the day. That's very similar to the fifth anxiety disorder we'll talk about, which is PTSD. It's the same kind of symptoms, it's the same reaction, but we only diagnose PTSD after a month has passed. And that's because many people will go through something stressful and for up to 4 weeks have these responses. But some people have a more difficult time dealing with what's happened, and so they'll likely require more intensive treatment, more intensive therapy. And that's when we would give PTSD as a diagnosis, when it's been more than 4 weeks since a traumatic event. PTSD, commonly researched with survivors of military combat, survivors of rape, survivors of abuse, a lot of pretty traumatic events. The final anxiety disorder is GAD, which stands for Generalized Anxiety Disorder. Now, this is a disorder given when someone has just general reoccurring thoughts of doom, or just a general feeling of being on edge and not knowing why. So unlike the others, GAD isn't tied to a specific thing or a specific event. So for that reason, we wait until 6 months has passed to give that diagnosis. A lot of people will go through things during their life and maybe they don't understand what's causing their anxiety, but it could be explained by a new job or a new friend. But if it's lasting 6 months, then that usually lets psychologists know that something more significant is probably happening. So make sure you know all 6 of those anxiety disorders. They're pretty similar in some ways, so you'll want to be able to tell them apart. One way to do that is to learn what each letter stands for, and then also learn the specific time limits that we place upon them, and be able to diagnose someone based on the symptoms that you are given in a question.